afternoon. My name is Mick Rage. I'm the CEO of Vachette and Stark Medical Auditing, and this is this week's update. Some interesting things going on out there. Just some FYIs. Talk to your lab directors. Talk to your people that you work with in this industry that are have questions, and perhaps maybe we'll answer some of them today. If not, give us a call. First of all, the federal rules created in response to two recently passed federal laws require private payers to cover all your COVID tests. So this is good news. This means your insurance plan can't not cover these tests. Now, they can cover it at a rate that they've negotiated or at a rate that they have pre-established. So be aware of that. Second, this is the most important thing. You have to make sure that you have on your website your cash price for this test. It's very, very important. There's some rules on this. The rules include that a requirement for providers to post their cash price for COVID tests on the public website or risk fines of up to $300 per day, according to the guidance in the documentation. So be aware of that. If you're doing COVID testing, make sure your cash price is on your website. When we look at this, this is part of an overall big strategy. It's part of the administration's push to kind of for transparency in healthcare. One of the things they wanted to push was transparency for 300 major procedures, including like joint replacements and such. So they put COVID testing as one of the transparencies that they want out there. So be aware of that. I know the American Hospital Association is fighting against this transparency concept, but be aware of it from the lab side or from your practice side, because that might become a thing in the next 6 to 12 months. Next, the United Healthcare Lab Registry Protocol. This was interesting. This is where United Healthcare came out and said they want all freestanding and outpatient labs must register their tests, including places of service 19, 21, and 81. Not tied to your contract type, by the way. But UHC confirmed today that there have been some, they've been working on some things on their end, and they're going to push this back to January 1st of 2021. This will come in place. This will be another hoop you have to jump through if you're working with United Healthcare. It's part of their process to track their testing and how they're spending their money and who they're sending their money to. Also, the referral sources and how that plays out. So be aware of this. Hospital pathology is included and will need to register separately. We'll be working with you. If you have questions on this, we're going to work on this the next couple months. We're going to have it very clear, very concise. Talk to your client rep at Vachette or at Stark, and we'll jump through those hoops to make sure you're done. This is done correctly with your billing people. Next, let's talk toxicology for a little bit. Boy, toxicology is taking a hit. They've had some big changes. COVID's made it so you can't really have group meetings in toxicology, so that's limited some billing on that side of the industry. Toxicology lab side has been hit also with a lot of patients not coming in, that volume falling to 40%. And then what happened is not too long ago, Palmetto, which is one of the Medicare intermediaries, came out and said they were going to change their compensation for a bunch of the toxicology CPT codes for lab, which was really bad. We actually did a revenue projection on this for some of our tox labs, and it was like a 70% reduction. It's scary, but what we found out now is that it seems that perhaps they jumped the gun on this. I know Palmetto was working with NILA, was working very closely with CGS, and then Nordan and Palmetto also. They all had similar drafts, but it looks like this policy has been retired. Don't be surprised if it pops back up next June or something once things mellow out. But it's good news if you're billing toxicology. You're not going to hit a 70% decline. Wouldn't be pretty. Let's talk Health and Human Services Provider Relief Fund. There's been a lot of questions from our clients who got this money from the Health and Human Services to move things forward. And the question is this a disaster payment? And what we found is Section 139 of the IRS code says basically no. A payment to a business, even if the business is a sole proprietorship, does not qualify as a qualified disaster relief payment under Section 139. The payment from the Provider Relief Fund is includable in gross income under Section 161 of the code. So make sure you report your HHS money that came in. This is actual revenue. It has to go on your QuickBooks. It has to go on your books. It has to be reported as revenue, and you will be taxed on that. Understand that. Couple other things when we look forward. The future of reporting requirements for the people who receive these funds. HHS has outlined the timing of the future reporting requirements for providers who receive payments more than $10,000 in aggregate. And everyone we know, every practice, every lab, every group we know received way more than $10,000. So what's going to happen is on August 17th, we're supposed to get some detailed instructions on how this payback would look and how it plays out. And how you, not payback, but how you have to report this. It's kind of like PPP. We're still waiting for the final SBA information on the PPP funds on how to report that back. This is the HHS version of the funds that they gave you. August 17th, we should get some instructions. October 1st, the first reporting will become available. February 15th of next year, your report will be due, and then July 31st of next year, the second report due for those who expended funds in 2021. This is good news. We'll be working with our groups, our practices, our labs to help fill out this paperwork, to help make sure they jump through the hoops correctly, so that they report this correctly, so that there's no penalty and no payback. A couple other things we got going on. Vachette's working very hard on the COVID side with some of our suppliers. We have a couple of very unique business relationships, vendors relationships we made lately. We do have access to about 800,000 antibody kits. These are FDA emergency use authorized approved kits. One of our clients has these, and they're willing to help share these across the nation. If your lab or your lab director or someone you know in your health system is looking for antibody kits, give us a ring. We can help you out with that. The second thing ties into what we see going forward. Is COVID testing going away? Absolutely not. This fall, we will have COVID-19. We'll probably have the next version, COVID-20, whatever they'll call it, and we will be testing for it. So we're working with a couple really good vendors who have both the access to equipment, reagents, and they can help get you authorized. And their goal is to get you up and running in a COVID lab as soon as possible. So if you're thinking about that, in the back of your head, hey, is it time to do a COVID lab? Or your health system says, should we develop a separate COVID lab here? Or maybe you and a couple of your partners want to talk about building a COVID lab? Give us a call. Give me a call directly. I'm Mick Rage. I'm the CEO of Vachette Stark Medical Auditing, and I'm looking forward to working with you. Thanks for taking a few minutes to see this video, and I'll talk to you next week. Take care.